Hi everyone! Today I'm here to talk to you about multimorbidity and the Covid-19 pandemic. More precisely about a study co-written by our international collaborator Sanghamitra Pati, which addressed the management of multimorbidity in the midst of a pandemic in a community in Odisha, India. The emergence of COVID-19 and its fast spread has caused concern for global public health. In this context, India is considered one of the 3 countries most affected by the disease due to its high number of confirmed cases daily. And while most of the local studies to date have talked about the effect of multiple chronic diseases on the prognosis of COVID-19 infection, there is still little information on the effects of the pandemic on the management of multimorbidity. Therefore, in this study, the authors have explored the effects of COVID-19 on care for multimorbidity among adults living in a community in the Khurda district of Odisha. The researchers' focus were the changes that occurred in the routine and emergency protocols, the influence of socio-demographic factors, and especially the perceived challenges in the management of care in these situations. The residents of Khurda in eastern India were selected for the study because the district is where the capital of the state of Odisha is located, together with the largest influx of travelers. In addition, Khurda was one of the most affected districts at the start of the pandemic, accounting for 1/5 of the cases, which spread from urban to rural areas quickly. For data collection, the researchers developed the MAC COVID-19 questionnaire, which contained questions about different characteristics such as age, sex of birth, and education, questions about the presence of multimorbidity, and most importantly, how patients perceive difficulties in caring for conditions after the emergence of COVID-19. Was it more difficult to practice physical exercises during the pandemic? Was it possible to continue to access the medicines needed for your treatment? Those were some of the questions. And it's important to remember that the interviewees were chosen at random and contacted in virtual or face-to-face interviews following all the established safety rules. After analyzing the data obtained in detail, the study authors realized that the participants reported difficulties of the most diverse types in caring for their conditions. Among 600 adults interviewed, 16% reported changes in their routine of physical activities, 12% reported changes in their diets, and 19% had changes in the continuity of treatment for multimorbidity. Another 18% said they had difficulties to consult with doctors, and 20% reported changes in their health screening routines. Thus, individuals with multimorbidity presented greater challenges when compared to those with only one health problem. Some of the biggest difficulties reported were related to transportation, financial issues, and the fear of getting to the hospital and being contaminated. Regarding social demographic characteristics, women, young people under 45 years old, individuals with higher educational levels, and residents of rural areas reported the greatest difficulties in relation to health. Based on everything that has been presented so far, the study concluded that patients with multimorbidity were significantly more affected by changes in the management of their conditions. Thus, measures are needed to help improve the situation, such as, for example, invest in individuals' time in discovering forms of physical activity that can be practiced at home. Health systems can also help by investing in telemedicine and finding a balance between prioritizing the treatment of COVID-19 and not neglecting the treatment of patients suffering from chronic diseases. Finally, other countries that, like India, are still in economic development can use the basis established by the MAC COVID-19 questionnaire to develop research that covers the needs of their own populations and helps to find solutions to similar situations. I hope you enjoyed this video. Are you interested in this theme? Then you can read the full article that inspired the production of this animation at the link in our description. And don't forget to share with your friends and subscribe to Divulga GBEM for more videos on multimorbidity and chronic diseases. Until next time, bye!